Good morning. Thank you, everybody, for coming out today. I'm David Demore, the Executive Director of the Lincy Institute in Brookings Mountain West. I want to thank you for taking some time this Tuesday morning fighting the wonderful road construction on Maryland Parkway. I think we have about 2 more years of that, as well as obviously the parking challenges here, but thank you so much. I want to talk a little about, set the stage for today. Just a little bit about us, Lincy, if you're not familiar with us. Today's topic really cuts across a number of our key policy areas, certainly social services, health, education, as well as Paul talked about, certainly the economic impact of the care economy there. And what we end up doing is we end up either creating our own policy briefs, or commissioning them out. The one on the left you may be familiar with. This is the one Tripp Umbach did earlier this year for us on the Children's Hospital initiative that we're involved with there. Where this comes from for us is we did some work coming out of COVID, looking at sort of what would be a policy agenda for Nevada post-COVID-19 there. And one of the things we did there was we did some demographic analysis looking forward into the decade of what Nevada's population is going to look like here. And I know this is a very complicated graph on this, but if you focus on the far right, that is the growth in the projected growth in the state among those who are 65 years of age and older. So you can see Nevada is getting older. We've always been a state that historically has been fairly young, but now that's starting to change there. When we broke it down by the regions, the north, the rural areas, and of course Southern Nevada, we find Southern Nevada is actually going to have the highest increase in those among 65 years of age or older, 2020 through 2030. So this is an issue now, particularly related to elder care, that is only going to grow, that needs only going to grow going forward there. We also looked at what's this going to mean for labor participation here. And what we see there is this is a ratio called the dependency ratio, which is the ratio of the number of people employed versus those unemployed in here, either those who are retired, not working, or children there. And over time, what you end up having here as you look at this is our share of employment in the workforce is going to decline. So that means those of us in the workforce are going to be working to support a much larger part of the population that will not be in the workforce there. And we obviously know we're obviously coming out of COVID. Nevada has, among the 50 states, the highest unemployment rate currently there. Washington, D.C. is a little bit above us, but we're not counting them there. Among the major metros, Las Vegas has the highest unemployment. I think it's at 6.1 right now. So this is a challenge for us as well on the workforce side of things. Earlier last spring, some of you may be in the room for this, we did a big event on the mental health care challenges facing Nevada here. So this was an event that the UNLV practice rolled out their strategic plan with help from Tripp Umbach here. We focused on the Be Here Nevada Mental Health Workforce Development Initiative that is in its second year here. And then we talked a little bit about a grant that the Lincy Institute is working on with the Department of Psychology to do asset mapping for K through 12 mental health services and a pilot program for early intervention here. This is, of course, a very big need in Southern Nevada in terms of part of the care economy here. We're not going to focus much on it today, but in our report, which I'll touch on in just a minute, we do cover the mental health care workforce and the deficits we need to overcome there. And then some of you may be familiar with this. I think Regent Brager, you were the chair of this committee that put this report together here. And this was essentially an analysis coming out of COVID of our child care needs here. And we're going to see Nevada as what we call a child care desert, pun intended. About 2/3 of our children in Nevada live in households with both parents working. So there is a strong need for child care there. One of the most stunning stats that comes out of this report is 3/4 of children under the age of 5 do not have access to licensed childcare, right? Due to high cost and not enough facilities out there, there's just simply a lot of families either struggle on the financial side of things or are unable to essentially find places for their children before they go into school there. And then we obviously know that this is on the employment side, something we'll touch on a little bit, particularly during the panel discussion, a huge barrier and hindrance for the growth of our economy, employment recruitment, and retention there. And then Las Vegas, of course, has its own challenges with the 24/7 economy here, right? You need childcare facilities that are open 24 hours a day, 7 days a week here. That's not necessarily the business model you see in a lot of the childcare facilities there. So we were involved in that report. We did some of the data analysis for what was used to be called GOIN. Now it's OWIN there. And I want to draw attention to this because part of that in that report was a survey of businesses to get their perspectives on childcare needs for their employees here. They are doing this again. So if you would like to participate in the survey, if you scan that QR code, it'll take you to a short survey there and allow you to complete that there. This will be available until right before Thanksgiving. It looks like the November 27th there. So please participate in that survey. That was really, really valuable data to get that perspective last year. And then, of course, what we're going to do today, we're releasing 2 reports today with this event. The one on the left was a grant that was funded by OWIN as part of the Empower model there, or the Empower data system there. And so what we looked at in that report is essentially where we are in terms of elder care, child care, and care for mental and behavioral health. And then we put forth a series of recommendations for what we need to do in the coming legislative session, as well as moving forward to build the care economy and the care workforce there. And then I'm going to turn over here in just a second to Paul Umbach, who's going to talk about their work looking at some peer market comparisons to that, as well as I think some of the stunning data on what this means for our economy. I'm going to turn it over to Paul. Some of you are probably familiar with Paul. He has this is just what we put in that report, what I just said there. Some of the recommendations there. So Paul has, of course, done lots of work with the Lincy Institute and other organizations in Southern Nevada. They did about 10 years ago now, the economic impact analysis that laid the groundwork for what is now the Kirk Kerkorian School of Medicine at UNLV. Most recently, we contracted with them to work on the Children's Hospital Initiative. So I'm going to turn it over to Paul, and he's going to talk about their work.
Okay. Thank you, Dave. I very much appreciate the relationship we've had with Lincy going back now probably almost 15 years. And it's always a real honor and a privilege to be working on projects that turn ideas into action and action into impact. And we have a topic today that really touches every one of us in the room. How many people in the room care for somebody, either an adult or a child? Okay, all right, and 2 there. All right. For those who didn't raise their hand, I'm sure all of you know people. But if you think about it, someday everybody in the room will need care if you're not needing it right now. And I think one thing that I was just thinking about, I watched the Buffalo Bills and Chiefs game on Sunday at my mom's house, and I was in the basement of the house where my 60-year-old sister, my younger sister, had made the entire basement into her house. And when Grandma, my mom, passes away, she's going to move upstairs. So there's an example of a solution that everybody's thinking about. But for people that don't have means and for people that don't have resources, those solutions become much, much more difficult. And then I have a daughter-in-law who now has had a 3rd child. And of course, she's not in the workforce because it doesn't pencil out even with 2 children. She relied on my wife to help babysit, and now she's at home. So what does this all mean? Well, I'm going to tell you a little story today about the care economy, but I want to start by just talking about the whole healthcare economy and social service economy. Now, you might say, well, there's an error in this slide because Paul's trying to tell us that the healthcare economy and social services, $3.8 trillion. That must be an error because we know it's a $5 trillion economy. This is just the care part of the $5 trillion. We spend $3.8 billion, trillion, I gotta get the word right, caring, which is 14% of our economy. And that's larger than the economies of France, Germany, and England. And if you think about it, when you think about all of that money being spent, you would think that in the United States, we would be in the best situation with care. We spend so much on care. But when you think about Nevada's healthcare economy, it's already lagging the United States by quite a bit. I learned this the first time I talked to Rob Lang when he said that if you look at our economy for healthcare, and this is the first time I talked with him years and years ago, that a big percent of it isn't here. It's in California. It's in neighboring states. It's every place but here. And I decided today to kind of set this stage to really then look through the lens of care workers and the care economy for what I call direct care. And you'll see it's just as far behind. So a third of the economy for care isn't there. And how do we do among peers? Well, as you move west from Kansas City, where I live, the percentage of the economy that goes to healthcare and social services gets smaller. And I know we like to always do peer market comparisons, so we mostly go west. But if we instead went east and north and included Minneapolis and Pittsburgh and started throwing in some Boston and some of the other East Coast cities, you would find that we're way behind in terms of how big the healthcare and social service sectors are. And you'd also see that while we're the lowest compared to the peer markets, we're the lowest. No market in the United States, none, have under 10% of their entire economy in either healthcare or social service. So when you look around, you can see the deficit, and it really just continues through my conversation here. So where are we? This is very tricky. So we're last among peer metros in the size of the care economy. And so we have this workforce crisis. Now they tell you as a presenter, never put numbers on a screen because people will be confused by the numbers. And the other thing they tell you is that keep your things just visual and have them look at you. But today, I want to play professor for just a second to show you how the numbers work, if you'll allow me. Well, as you can see, there's about 21.2 million direct care workers. Now, what's a direct care worker? It's someone who cares for either children, seniors or elderly, or persons with disability, and they're actually doing the care. They're doing it. They're not administrating, they're not driving the van, they're not doing the billing and paperwork, and incidentally, that's where the other part of the $5 trillion is. It's mostly lawyers, accountants, and people taking money from the system. But these are the care workers, 21 million of them. Well, based on your fair share, the 0.007, that's how much Clark County / Las Vegas Metro is the share of the country. You should have 148,400 if you had your fair share. Now you might know, or you might not know what this thing called the location quotient is. Well, we use them all the time in my business because it helps people understand what share of the national pie you have or not. And for direct care workers, it's 0.69. What that means is you only have 69% of that part of the economy. The other 40% or 31% is missing. And then when you start to see that we only have 102,300 care workers, and that means that we're missing about 46,100 of them. This simple math equation that we now can all understand tells us that we're way behind in having care workers. It also shows that the cost, because of our low supply, is very, very high. So what this is just simple supply and demand. Why are we the most expensive place for care in the United States? Well, because there's not a lot of care workers and a lot of people need care. And as Dave showed you with the earlier slides, it's just going to get worse. So this is really kind of just at the beginning of understanding how dramatic this is going to be in the future for elders, but also for childcare. So about 20% of the income of a family goes to childcare. And what you're going to see as you go further down, that we're much higher than peer markets. And even the peer markets are much lower than the national average of what it costs. And you might have seen articles on this, like in the New York Times. This has been well publicized, this 20% number. And here it's the same for toddlers as it is for young children. So there's a need for more direct care workers. And as you can see, if you break it down by child, home care, and then other kind, and that would be all other kinds of care, there's a very big missing 7,800 direct care workers in the market. So one of the things that we start thinking about is we're missing these 3,305 direct care workers, and yet the demand is increased, but the supply of care workers has gone down 17% since 2014. So we got the worst situation here. Fewer care workers, and I'm looking at the person who's in charge of the care of the campus, and she's going to be on the panel. We have higher cost. And then we got the worst thing of all, and that is that we're starting to be behind the curve before the curve even starts to grow with elder care, which is going to grow even more. So that's not a good situation to be in. And workforce issues are most dire in childcare, and it's because the other sectors actually have some infrastructure in place. There's a home care industry. There's an industry and some payment that's part of that. But when you get to childcare, it's a patchwork quilt of nothing that makes sense, and there's no real support in that area for childcare. So that's why it's the most dire. Like I said, many of us in this room are part of the 53 million Americans that provide unpaid care for loved ones, and that hurts the economy because now you don't have people out there. And that's about $470 billion if that was paid for into the economy. So you have this $407 billion that's missing, and you have all of this work that's being done that's not helping the economy. But there's even a bigger issue that I'll get to, and that is that prime working age adults, mostly women, are leaving the workforce. So just like my daughter-in-law, and yet we come from a family of means. So I guess they work it out and she stays home, but they're able to still survive. But if you go then and start to look at the fact that the economy is losing 46,200 people, that comes out, and nationally it's about 6.6 million, according to the Census Bureau, are out of the workforce because they just can't afford to take care of people. And lack of affordable child care forces more than a quarter of young parents and families to leave the workforce. So this is the situation we're in, and we start to realize as we run the numbers that it's actually costing us more in the economy to not have people out working than we're gaining from the care economy in total. So we're looking at family caregivers lose all of these wages, about $500 billion in wages, and that is about $4.6 billion in loss of wages here in Southern Nevada. And those folks that are losing all of that money aren't making as much money in the economy. And as a result, we start to see the economic impact to the economy being very, very significant. And we start to then get into a situation where for every dollar that the care economy is helping the economy, the lack of care is costing $1.45. So we're actually swimming in the wrong direction. If people were able to be out in the economy, working, being productive, starting businesses, and growing their careers, and it's not just for childcare, because it works both ways. There are many, many millions of people in America that are my age, 62, and aren't in the market. It's mostly women because they have to take care of elderly parents. So go back to my sister, my 60-year-old sister. Let's say mom really, really needs her and she's got to move upstairs faster than we thought she had to move upstairs. Well, when she moves upstairs, she can't go to work. And all of a sudden now her retirement and her financial security when she becomes the one. And I think my nephew Grant's going to move into the basement next. I think the plan is Grant moves in the basement, and when Mary, my 6-year-old sister, needs care, then he moves upstairs. I don't know who's going to move into the basement then, because like all the young boys in the family, none have held hands or kissed or had relationships, and nobody's planning to have children, which might fix the problem. But as you can see from this story I'm telling, we have a situation where adults leaving the Southern Nevada workforce are costing the economy. It's even worse here because the economy is so human-driven. Okay, so if you're in a place like Kansas City, most people go and sit at a computer and work in tech. Like a third of our economy is people sitting at home on computers. It's a tech center. We have big data centers. It's huge. Everyone's in tech. The problem is nobody cares for anybody and nobody goes to work and does anything. So as a result, it doesn't really hurt the economy that much if people are at home taking care of somebody. But here people actually go to work, and there's a lot of work that you can't do unless you're at work. Well, here we start to see that the people caring for people are unable to fuel the economy that needs them. Workforce absences triggers significant costs. You can see that. And you're also going to see that the literature is replete with every kind of study showing that if we invest in childcare and elder care, we're in a situation where the return on that investment is significant, and probably $3 back or more for every dollar in. Every study that I looked at says that this is the single best investment you can make. Now, I told myself this morning when I woke up, you're not going to tell the story of your daughter-in-law, Chandler. Don't talk about Chandler. We're tired of Chandler. One of my daughter-in-laws makes $90,000 a year as a dog sitter and social influencer. Now, she's never at Christmas dinner, she's never at Thanksgiving, because she can get $300 an hour from rich people to watch their dogs and cats, so that's the downside of it. And she does do a lot of, she's number one in this is in Kansas City, think of what she'd make in the coast, you know? And so we have a situation that it just doesn't work in America to take care of a child or an older folks economically. The pay, I don't have a chart on it, is the lowest of any pay. It's actually at the lowest of all the low in terms of pay. And then I throw you this 25-year-old or 27-year-old who can make a really good income just walking dogs and sitting for dogs and taking care of dogs. She also makes clothes for dogs and products for dogs. So that the $90,000 is not just walking, but it's the dog industry. And it's unlimited how much money is in the pet industry. But what about the child industry? And what about the elder industry? Or what about persons with disabilities? So we know that investing in this, but we got it all kind of wrong. And I think part of it is that we were just messed up in the way it all came to be, not valuing young people or old people. And we start to see that people in Nevada care about this. And one thing I was really happy to see when I read the workforce report, and thank you for those who worked on the governor's workforce report, that really helped me, gave me some data to work with the economic analysis I was doing. And one of the things that was really interesting was that not just that workforce study, but a survey that was done recently by the Maryland School of Public Health and Public Policy showed that 70 and 80% of all Nevadans care about what we're talking about. And in a polarized situation where it's 51% to 49% on just about everything, this is an area where 80% support federal funding and 73% want to give tax credits or even direct payments. This is a home run for policy folks. And we're going to be meeting after today to talk about really what are the next steps in pushing for some of these things that I'm going to talk about in just a second. So how do we get out of this mess? What's a path forward? Well, one thing I'll tell you about things like this, because I'm in my 40th year out on the road and I've worked in 500 markets doing this, is that when we see trends, they always happen because you can't slow down a trend. If the people are getting older, I mentioned 40 years because I was that young consultant 40 years ago, and I thought I'd be a young consultant forever. I'm not anymore. Well, guess what? What does it mean for every one of you in the room? It's going to happen. We're going to get older, and the market's going to get older. And young people are still going to move here because it's a great place to start your life, and they're going to have children. They might not have as many children as past generations, but there's going to be children, there's going to be old people. So what are the path? How do we get out of this mess? Well, one of the ways we get out of it is we start expanding access to affordable child and elder care. And the good news here, and if you read the report, there's an appendice that has all the stuff going on in all of our neighboring states. And there's much going on. And there's stuff going on in Nevada. Oh my gosh, drop this. And there's stuff going on in Nevada. And the bottom line here is that we're in a situation where there is enough national best practices out there. So when it comes to expanding access to affordable care, there are programs that we can model, and there's some programs already being discussed. That's a miracle that it worked after that. But then there's deeper things to do. Raising the minimum wage, workforce development programs, expanding community health worker programs. This is the hard part of workforce development because we're going to have to start pushing for more pay for the providers to get the providers up. But we also have to make sure that that doesn't push the cost up, because now, we all know this during COVID. When we came out of COVID, one of the reasons why prices went up everywhere is wages were going up too. It translated into higher prices. Nobody liked that. An entire election can be lost on just that. And then at that point, we start realizing, but it's fair that dog sitters shouldn't make more than childcare workers, so why don't we figure it out? Well, you have to work on the policy. It's two levers. So we have to also look at how to make people want to go into caregiving, and right now that's part of it. The 43,000 direct care workers we're missing, well, there might be a reason why it's so hard to fill that, because who wants to be in that kind of a low-pay situation? And then there's enhancing support for unpaid care workers, the 53 million people that are taking care of somebody with no pay and giving up a lot of their life, giving up a lot of their career, giving up a lot of their own financial security, and it's cyclical. My financial security now, like my sister, is not going to be as strong taking care of mom, and that then causes intergenerational care issues that lead to poor health, poor economic opportunity, and they all go together. So finding ways to really take care of those who take care is going to be an important strategy, and I have some examples in the report on that as well. And then improving healthcare access and infrastructure. This is really the big picture here. Just like Kansas City was Vegas before Vegas, and Kansas City was the end of the road, and it took a long time, like 100 plus years, to build what we now have in Kansas City. And of course, our mobsters all came here. Go to the Mob Museum, you'll read all about Kansas City. And we didn't have laws, and we didn't have prohibition, and all that. But Kansas City got a 100-year plus head start on building all that infrastructure. So now if you see Kansas City, you'll look at it and say, wow, it looks pretty good there. Well, it wasn't 100 years ago. It was just like Las Vegas 100 years ago, because Las Vegas wasn't here yet. So Kansas City had to be the place. Well, you don't have 100 years to get the infrastructure and access together because 3 million people now live here. How did that happen? Well, it happened. And now we have to start looking at how can we build the healthcare access and infrastructure. And that's why it's such a panic. Kansas City had 100 years to build Children's Mercy Hospital, which is 100 years old. They had 100 years to build medical schools and infrastructure. They're all 100 years old. What happened? Well, Vegas came around, and we didn't have the time to build up for so many people coming. Encouraging innovation in healthcare delivery, there's best practices on that. I think one of the ways you solve a problem when the only way you know how to solve it is brick on brick on brick. My Kansas City example, going back 100 years, you don't have 100 years. You have to have it now. So you have to innovate and say, okay, we can't wait 100 years to get to all the things we need to have. So let's look at ways to look at value-based payment models. We need to look at different ways to build hubs where seniors and children can come together. Why do we bifurcate the system? You have elderly people that don't need care, but they could care for children. Why do we have community members that are all broken? It's because of payment. It's because of the bureaucracy of care in America. And why do we spend $5 trillion and have the worst health status in the world with the worst life expectancy in the world? How do we get there? Well, it's the same way with this. Why don't we find innovative models for care delivery that could really be piloted in a place that needs it so bad? Raising public awareness is so important. And it doesn't just begin here. It's been going on forever. I think one thing I learned about standing here at Greenspun Hall is I do feel like a preacher, and I do feel like I'm always preaching to the choir. But I also have to realize that sometimes being preached at and being preached back at and being in conversation like we'll do in the panel encourages us in that panel discussion to raise public awareness, because we're encouraged to leave this place and say, hey, there are people I met that care about this issue. There are people I met that want a children's hospital. There are people I met that want mental health services. Today it's child care and elder care. But in a way, we start to look at this being a very important piece of the puzzle. My last slide is some takeaways, but that's just boring data. The one I'll tell you that's not boring to me is the fact that what we call the care economy isn't working. The people are so badly paid and it's such a fragmented system, it's not even driving the economy. It's probably less than 0.5% of the economy, direct care. But then direct care is actually costing us more than it's driving the economy. It's a drain on the economy. But one thing I want to end with is something I should start with. They always say start with a vision. Well, I don't know. I decided to end with a vision. In my spare time, while writing the report, I thought to myself, I was getting pretty depressed. And you can all read this. I'm not going to read it too many words. And I thought to myself, why do we always come and say how dark and sad the situation, whatever the situation is? In 15 years of standing and talking about the situation, I said, well, why don't we cast a vision for what it could be in 15 years? Now, 2040 sounds like it's a long time from now. It's 6 weeks and 15 years. Well, let's just go back 15 years, use simple math. 15 years ago was 2010. Well, 2010 does not seem too far back. I have clothes from 2000. I have shoes. I might have bread at home from 2010. I'm wearing things probably that are from 2010. So that's not very long ago, okay? Do we all agree 2010 wasn't very long ago? Well, that's how fast 2040 is. And I'm going to leave you before we transition to the panel discussion about the fact that time goes fast. We don't have a lot of time. And we're in a situation right now where the economy is being really held back, but not just the economy. People, their lives, their health, their prosperity, their quality of life are being held back. And what does that mean when that happens? One of two things. You leave the market, and now we have even fewer healthcare and care people. Or you stay in the market and you don't thrive. And soon you'll have high unemployment. You'll have housing costs for nobody, and all the other issues. If you want to hear about all the other issues, please keep coming to these forums. You will know about all the issues going on in Southern Nevada. If this is your one source for what's going on in Southern Nevada, go to the Lincy website and Brookings Mountain West. But if you want to get out of it, we got to look at this vision. We have to say, let's get there and have a bold, forward-thinking actions that can start doing something. So I'm going to hand it back to my friend Dave. And thank you so much. I hope this was helpful. And invite the panelists forward. Good.
All right, thank you, Paul. Excellent job as always. Depressing news, but at least you give us a pass forward, so I appreciate that.
I ended with something very, very inspirational, I think. I tried.
I know. We appreciate that. So the program, the event program has the full bios of the panelists as well. But just real quickly to my left, we have Dr. Ji-Won Yu, who is the Kirk School of Medicine there, and he is overseeing the recently created Geriatrics Fellowship Program with an expertise in health, aging, and social policy. So thank you for joining us today. Next to him, we have Hugh Anderson. Hugh wears lots and lots of hats. I think he got rid of one of them. So he is the managing director at Hightower Las Vegas. He chairs the Vegas Chairs Governor Affairs, and he is the outgoing chair of the Governor's Workforce Development Board. Thank you for joining us. Next to him, we have Jenna Weglert-Ward. Did I get that right? I did that right. All right. She's Associate Professor of Early Childhood and Special Education, and she is also the Research Director at the Lynn Bennett Early Childhood Education Center. And of course, joining us is Paul to give us that national perspective. Jenna, I want to start with you. We'll start at the bottom part of the age distribution. So can you share a little bit about the work you do as a research coordinator at the Lynn Bennett Early Childhood Education Center? I don't know if everybody's familiar with this, but this is a wonderful preschool on the other side of campus with a very, very long waiting list, as we talked about, 3 years on that one there. So what does your work reveal? Tell us about the current state of childcare in Southern Nevada and Nevada.
Yeah, so the Lynn Bennett Early Childhood Education Center, which we invite you all to visit, is on the other side of campus, and we've actually had childcare on this campus for decades. But in 2004, we built this beautiful kind of state-of-the-art building there that houses currently about 150 children and their families from Southern Nevada, and it really serves families from a multitude of sectors. So we have community members, faculty, staff, and especially our students on campus, and to provide them with high quality, full-time childcare that runs year-round for them. And so my role there is to, one, support their staff and their children and families in a multitude of ways as a faculty member, and especially to help researchers around really Southern Nevada, the state, and nationally to engage in research that can be really helpful to improve the quality of early care and education for young children, as well as investigate, issues that go up through the care economy, I think a little bit as well, looking at childcare of children up through school-age children as well. And I really act as a way to help researchers figure out what are some really important questions to ask, and then how can we answer those questions? And then once we have the answers to those questions, how can we use those findings to actually create change that's needed to support children and families in Southern Nevada specifically? So I do lots of things. So generally there, I'm really though to help people learn more, and then what from we learn actually do more and do better for our children and families. With that as well, I also support myself and other faculty and other entities really pull in available funding. That is, whatever is available, we'll take. So we have a lot of sources of funding to support our center. The tuition itself mostly is parent, tuition, which is what most childcare programs are. We also receive funding from the university and our student organization, and then we also have private donors. And then our large component for our student population is actually funded by a federal grant that is Child Care Access, means Parents in School, which thankfully lots of our institutions across Nevada also have this funding available. So at UNL, we provide full tuition assistance for children, students that have young children under 5 that meet some requirements. And so they get all of their tuition paid for, which is a huge financial relief for them. Additionally, though, we also provide wraparound services to help them kind of navigate the balance between being a good student and also feeling like you're also a good parent, because sometimes working parents and parents who are trying to also go to school for things also feel like they're doing nothing right. So we provide some support for them to really gain that confidence and build a network with other families so they feel supported. So that's really good work there. I think also the center also acts as a model program, and we have people come from all over the world to see our center, but we really invite that to see, like, what have we done that's really working? What are the things that we've tried that haven't worked out really well? How have we navigated this post-COVID place, which you alluded to, how things have really changed in this space of navigating the increase of cost to just run a center generally, how to not raise tuition costs so much so that it's out of reach, but also pay our staff. So we've worked really all those things. And we also try to provide an example of really high quality early child education, which is also inclusive of multilingual learners and their families and children with disabilities. So we really try to provide not just we're doing lots of great things ourselves, but also share what we're doing with other people. And we also really build relationships with other places in Nevada. I was telling people earlier today, I spent the day at CSN last week working with their program and just sharing and collaborating on how can we really support all of the needs in Nevada so that people have what they need to do what they want, either with their education or their careers.
You had mentioned COVID-19, right? And so one of the things we know coming out of COVID was the emphasis on mental health care, right? That was certainly laid bare during COVID there, and I think policy responses there. Do you see a similar shift in the value towards childcare coming out of COVID than you did before?
I would like to say yes. So during COVID, I mean, like 2020, like deep COVID, dark times, right? Childcare providers were deemed essential workers, right? Like nurses and firefighters. And I was like, oh, we've done it. We're seen as essential. We are like essential, important. And that was a time where it really demonstrated that we do need care for everything else in our society to work, right? You need doctors to have childcare for their children so that they can provide you care. We need bus drivers to have care so you can get to where you want to go, all of those things. And I was really optimistic. And then I've not been as optimistic as possible. But I do think it put a point where it did bring some focus to early care and education that we really never had before. And so even though we haven't kept that kind of momentum moving, we still are at a better place where people are at least having conversations and figuring out how do we better support that sector in our society. So we have had, and I will say too, we've seen more public investment, and our COVID relief dollars especially were very, very helpful in providing professional development, for providing tuition assistance for families, providing higher wages to staff. And now what we're dealing with is how do we now, without those funds, keep some of those initiatives moving forward? And we'll talk about policy later. So I think it helped move a little forward. And so I just keep saying, like, remember that we are essential, and that what can we do to maintain us being essential to the rest of society?
Yeah, I know that we're not the only state facing that challenge as the federal dollars go away and how we're going to move forward. Jill, I want to turn to you here. And if you could talk to us a little bit about the recently created Geriatrics Fellowship Program, where you serve as the program lead. Can you tell us about the program, how it's working to address access and quality of elder care services in Southern Nevada?
Thank you, Dave. Thank you for inviting me and then the geriatrics, the attention. We started 2019. The fellowship program is the means after the post-medical graduate, the additional, the advanced, the degree, kind of the degree. Also, here is Dr. Chong is one of our graduate fellow also here. So is the witness the program, which means we also have the funding, federal, state, and also nonprofit organization. We assess the care need where geographic location the care need, also which care type need. So we identify for sure the rural, like for example, the White Pine County and Pyramid Lake area, and also the nursing home, especially the Medicaid-driven nursing home. Also the dementia population. We try to prevent nursing home placement, the community living dementia population. So we also think about how to advance our care delivery. So for sure, the telehealth is one of the delivery tool. So we apply that, which means we serve the telehealth, also the how to deliver the telehealth is and make the more like a scalable the way. So then we figure out the telehealth training and may cut down the caregiver cost by 25%. So we publish it with our School of Public Health team, the Yeonsu Kim. So we realized in the 5 years, like the training, so some like a care profile part working well. For example, the advanced care planning that is easily deliverable to the telehealth and with the other healthcare professional. But the challenge part is the prescription part. Like for example, like 1 in 3, the patient is getting the benzodiazepine, which means sleep medication, anxiety medication. That is not easy to take it out, to change the prescription pattern of the providers. So we lesson learned. Also, we are challenged sending the like a healthcare workforce in the rural underserved community. So luckily, we are working with Nevada Senior Services, also the University of Nevada, Reno Sanford Center of Aging, and also the Cleveland Clinic and other partners. We try to send the healthcare workers to the rural and underserved community. And then they're participating the service and also the training. So that is our role. So now is the starting like Dr. Chong over here, the program here, but we started like a grain of mustard seed and then tried to change the landscape of the southern Nevada. So we trained about 3,000 healthcare workforce, caregivers, and patients every year. So more than 10,000 the trainees we deliver the training service.
So I think we have at least two big challenges in the elder care, right? The first is the scaling, which you talked about, telehealth there. But as we know, the demographic data says that this is just going to become bigger. The demand is just going to continue to grow there. But when we were doing our pre-call the other day, you brought up a couple interesting points that I hadn't thought about, so I appreciate you do that. But how do we adapt? And you had talked a little bit about some of the issues with the mental health, the suicide rates among those 65 years and older, as well as the substance abuse issues among that cohort. How do you adapt the elder care model to the Southern Nevada demographics?
Yeah, so we have like a 50 states annual like a report. So the Nevada, specifically the Las Vegas, remains the top or bottom of the suicidal rate or like excessive the drinking. We are living in the gambling and gaming like environment. So that is also our role is the elder care. It has to be additional to the like mental health, the counseling. So usually the primary care like handles like under HMO, health care maintenance environment. The primary care is concentrated like the gateway role, but it has to be involved like the mental health like role as well. So that is the lesson learned for the elder care in this environment.
Thank you. Here, I want to turn to you here to get the perspective from the business side of the world. So you obviously run a business. You are engaged in the biggest business organization in the state, the Vegas Chamber, and you were recently, of course, heading the governor's workforce development board now. So from your perspective, what do you see the challenges from the business side on both the child care and the elder care?
Well, David, when we first embarked on this coming out of COVID, Nevada and Southern Nevada specifically was very slow to emerge, even though we were ground zero. And we started investigating at the Governor's Workforce Development Board to figure out what was causing this slow recovery in such a vibrant, dynamic economy, even though it's so concentrated in hospitality and tourism. And the beauty of the Governor's Workforce Development Board is more than half of the board is comprised of business leaders. So as we surveyed these causes, we found that the ability for people to reenter the workforce was being stymied by the healthcare problem. The child care problem. And so we had all of these families that either had to leave one or both parents home, depending upon the circumstances they were dealing with. And I've got to give a shout out to our Regent Susan Brager, who wears two hats as a public servant as well as a business owner. And we pursued this vigorously to find out, well, what are the impediments? So one of the things at one of the meetings, and you had been at several of our meetings, David, as well, we discovered that the religious community is very, very enthusiastic about putting their facilities to better use because they're very underutilized. And they would love to be able to coordinate neighborhood-centered daycare facilities if it could be done. And so what we started exploring was child safety first, of course, and elder care safety first. But what regulations and policies are in place that prevent any of this from being developed? And so we started working on that to some degree. We also started looking at public-private partnerships. But one of the things that astounded us was the child care tax credit 45F. It's a very, very significant federal program that the business community did not know anything about. And the Vegas Chamber did a survey to find out about it, and I think the level of knowledge about it was something around 17, 20%. It was very, very low. And so going back to the advocacy and the promotion, I think if we start elevating the fact that this is a problem, we do need to elevate the professional stature of the care industry. So if you look at the healthcare industry, you have an entire spectrum of nursing, from entry level to very advanced. Child care and elder care should be the same thing, where we elevate the wages based on stackable certificates or what have you to make sure that these people are treated with respect, because they're treating our most valuable resources with respect, and AKA children and so forth. So we think there's a lot of opportunity to elevate the problem. Everybody in this room knows there is a problem. Most people functionally know there's a problem because many of them are stuck out of the workforce. And we think that, again, bringing it to our legislators and our policymakers to start thinking through the challenges of keeping the economics sound. So as an example, there was this big hue and cry in California when they raised the fast food industry to $20 an hour. Well, recent studies show there's been no layoffs. As a matter of fact, there's been an increase in employment. And so the challenge there is, maybe it's not the wages, it's the unaffordability of California is their land use policies of making housing so unaffordable. So we can shed more light on the situation and truly fix the problem, but we have to start addressing it and focusing on it.
Yeah. When we were working on our report, one of the things we came across was a study by the Bipartisan Policy Center. They essentially create a framework exactly for what you're talking about, right? Tiering the education expectations for those jobs, tiering the wages with them, creating upward mobility within the industry, and so there is a little bit of a framework that we put in there, and we hope that our legislators do take that up there. Paul, I want to touch on you. So obviously you'd like to do peer market comparisons. That's something you do. But as we always, when we work with you, we're like, well, is there a peer market for us, right? In terms of our demographics, in terms of our just the 24/7 nature of our economy here, and some of those other challenges there, right? So, given taking us out of the sort of pure comparison there, what would you suggest is our best path forward to get us there? What's the low hanging fruit that we can start with?
Well, I think that if you look at what some of the neighboring states like Utah, Arizona, I always usually leave California out. It's an outlier. It's its own world, sort of. And you start to think about what can happen with fast wins. And I feel that what the report I read and the reports show that there were some great recommendations from the governor's workforce report. I think there are some things that could even get in place in the legislative session coming up. And it's really just starting the process of giving people not just the awareness of the program, but an easier pathway to the program so that they can stay in the workforce. And I think one of the things about government grants programs is they're difficult to deal with and they're not well known. Well, those are two bad things. And so even working to make them more known and more easy to deal with could be important. And then the other thing to keep in mind is that people want this. Did you see the data on? So it shouldn't be a politically hard thing. It's going to be on both sides of the aisle. It's going to be, so somebody just has to find some product to sell. The ice cream that we're selling should have a long line wanting to eat it, and yet we're not selling it because we're not good at selling it, but we have to work on it. So that's what I would do, is find a way from the pure best practices, something that you can find a way to sell to the legislature and get moving on it, and not just say, well, we'll wait for the federal government to fix it because we know what will happen there.
Nothing.
Less than nothing.
Yeah. One, I think the key takeaways from your report and your presentation was, Dave, was how much of the economy is missing because of these challenges here, right? So, not just in terms of the workforce, but the folks who are providing the unpaid care there. Jen, in your work, right, so you're dealing with new parents mostly, right? And they often are going to be in this decision, do I try to sort of patch this together? Do I leave the workforce? And what's that calculus look like from the parent side? And particularly those who may be in that sort of sandwich generation, right? Those who have young children and also older parents who they're caring for.
I think it's a very difficult decision for each family, and each family needs to make it on their own, and there's a lot of factors that go into that. I think what's happened, particularly over the past 20 years, is the expectation that parents will be working, that they will be working. So before, 20, and I have 4 children and a very different age group. And so my first child, the assumption was that one of us would stay home. And if economically we could totally afford that, to have one parent completely stay home and live on one income. That is not an option anymore, to live off of one income, unless you have a very great income, which I hope you all do. Our household did not. I worked in early childhood, and my husband is a paramedic, so we were not rolling in the dough. But so I think, and then my last child, who is now 13, it was the assumption that he would go to childcare. So there has been a shift in expectations generally in what will happen, and so most families have to address that. And then they have to figure out what works for them. One, personally, what are their desires? Do they want to be in the workforce and that component? But also, can they afford it? And a lot of families, if they have multiple grown-ups that are working, one income is primarily taking care of care, is paying for care. And whether that's child care and elder care, which we're seeing more and more families managing that. I think you talked about, too, this component of I see a lot with grandparents, too, grandparents caring for a young child and maybe also their parent. And so there's this piece of, and families where and maybe they're also working full time and they have young children, and they also have older parents that even if they're not living with them, they still have to manage their care, whether they're in a nursing home or they're living at home and having to manage care, which my mother would love to tell you about her experience caring for her mother, just managing that care of, understanding doctor's appointments and all of those things. And so families have to figure that out, what works for them, while also balancing their mental health. And what we've learned since COVID especially, we've been doing interviews, especially with new families that welcome children during COVID, the anxiety and depression levels are much higher than they have been before because of this stress and balance of the financial, stress of living today, but also like, do I make the investment in childcare? Do I go back to work? Like, what are those balances too? And I think a component, and this was in your report as well, is that we don't have paid leave in the United States. And so maybe your employer provides you with some weeks of paid leave, but generally not enough to even cover 3 months, those first 3 months of welcoming a new child to your family. And so there's this pressure of going back very quickly. And then I think, he was saying too, like, we're really our most vulnerable citizens. We are, giving over care to a workforce that is not necessarily trained. Now, we do have people that are amazingly trained, have been doing it for really long and high quality, but generally the standard of employment is very low expectations, and the pay is also extremely low for those employees. So I think I'm weaving around your question a little bit. So redirect me. But I think it's a real. What we've found with families, it's a very, very difficult decision, and it's also most families now as well need multiple sources for care. So maybe they are using a childcare center during the business hours of the week, but then using an additional care provider in evenings and weekends, or they're using a family friend and neighbor care to kind of make that system work for their family. Because most people now don't work 9 to 5, but most of our childcare programs those are the hours that they're open. And so maybe you're doing things, or my family, we work different shifts. I think because my husband works in a field that is a 24-hour job, he worked nights for 10 years so that we could balance care, which also means he was very tired for 10 years as well, or he worked 24 hours. So we've been really good at balancing, like, what are our schedules, and literally like handing off children in a parking lot, while one parent goes here. But that also stresses the family system as well, because then you're also not spending time as a family together, especially in those early years. And I will say in the later years too, where they're so essential to spend time with that valuable time with your children. I think my 13-year-old does not want to spend valuable time with the family, but those early years, I think that was really, really important to get there. And so it's just so complicated. And most families too generally will pick a program that is the most convenient in location. Is it closest to my house or closest to my work? And can I afford it? The quality is not the primary decision factor, because we'll just take whatever we can get that makes our budget and works with our lives, we'll take. And if it's high quality, that is a bonus. But it's not the first thing that families are going to select and go for.
Yeah. The convenience trumps it, absolutely. So hearing that, Hugh, from the business perspective, right? If you're a business owner, what do you're dealing with managing your employees, running your business there. How do you deal with this?
Well, the surveys indicate that, first of all, you have to listen to your employees. And the most important thing, that you have an overriding thing with different industries like mining and hospitality. They have 24/7 needs. But the reality is many employees want paid time off, flexibility, and what have you. So if they can't afford 5 days a week of childcare, let me work from home 2 days a week. Now I only need childcare for 3 days a week at an institution or my older care and so forth. So I think the employer listening to the employees is very, very critical, and it's germane, of course, to their business. And of course, I don't believe you can build significant culture via Zoom. Being in the same room in this kind of environment is how you build culture. But by the same token, COVID has told us that, things can continue to work with some adaptability and flexibility. And we have a fairly young team of people on our team, and family first is our motto, that you're going to do what's right for your family as you see fit. And as long as you can shoulder the demands of the responsibilities you have to us, we'll accommodate whatever you need at this particular time in your life. So it's really flexibility and listening. And again, recognizing that there are resources out there. So I always go back to, we had conversations with the individuals who used to run Palace Station's childcare enterprise, and they don't do it anymore. And it was a function of just the overbearing burden of the regulations and everything else, when this was a corporation that was trying to accommodate their employees' needs and basically, force them out of that accommodation. And I think you have neighborhoods where you have the mom who wants to stay home, has that 1 or 2 children, and has the capacity to take on 2 or 3 more, and with the right remuneration would be more than willing to do that. What do we have to do to clear the decks? So number one, those children are safe, first and foremost, but does she have to have 42.7 square feet of grass in her yard? Or if there's a park 2 blocks away, can she in fact take the children to the park every day? So those are the kind of things that we want to really clear the decks with and make it practical to start getting some of these solutions.
And do you find that employers become much more receptive to this coming out of COVID, that this is just sort of the world we're living in, and they understand, right? Retention's important, right? It takes a lot of effort to recruit new employees, so there's a strong incentive if you've got good employees to make it work for them.
Absolutely, absolutely.
Yeah. Turn back to Eugene. Didn't forget about you there. So this is a new initiative that you're the geriatric fellowship program, right? Moving the needle to scale this and to really address our sort of needs there to overcome the deficits that we have there. What is the keys to making a sustainable elder care workforce in Nevada?
The healthcare like a system needs the investment. For example, the healthcare, like the information exchange. You say the medical record. so now system is fragmented, but has to be more interchangeable. The information. That is the one thing. Second thing is the payment is the still like a little bit like it's the byproduct of the fragmented system. The payment is still like the current provider system prefer the P4 service, like the individual care, the point of care based. Now, as the Paul mentioned, the more like a value based or prospective, the payment system may like advance the care efficiency, which means the saves cost. So that is the kind of a infrastructure, like the investment that has to be done. Yeah.
I think one of the other challenges, both the elder and the child care, is just also the turnover in those workforces, right? I mean, we were doing that. I think you cover that in your report as well, Paul, is how much turnover there is, and that people will leave one job or another for just a slight increase there. I know at least Nevada last legislative session, we had a wage increase for home health care workers through SEIU. They're trying to push it up to $20 here. The wages are very low in child care here. So how do we sort of balance the increased pay required to sort of create a stable workforce, but also make these services affordable? That seems to be the real challenge.
Right, very challenging. So the workforce is, I mean, the wage is very important. Also, let them understand what they are doing. So let them know the mission, what they are doing. The healthcare, usually the workers. Usually they declare, I will be the Hippocrates, I will be the Nightingale. They have own the mission. So Dr. Chong, the leader of the geriatric team, and also she knows how to convince the trainees. So what you are doing, what is your work is impact the individual the care, and also how to change our family landscape and also the whole community. That is the kind of our the approach, the training approach. So it's if we translate this to the academic term, you may aware of the Donabedian, the framework, SPO, Structure, Process, Outcome Framework. So our approach is the highlighting the process rather than structure investment. I mean, this is a wish list. Maybe we can recruit from the Ohio, the top class, like a Cleveland Clinic neurosurgeon. Maybe to bring them about 10 neurosurgeons in town, or we can resolve any like a brain cancer and then brain surgery thing like in-house, but it cannot happen. We cannot bring the Stanford like a liver specialist. We can bring the whole liver like a center and bring to the next to the UMC. It never happened. But if we ignite the individuals like a mission, why did you become to be the nurse and the mission find like a Medicaid nursing home? That is kind of our approach. And also we try to apply we call the 4M. 4M means like M, mnemonics, like the what matters, mobility, medication matters. That is more integrated and also the locally adaptable by the care site, and also evidence-based by the Institute of Healthcare Improvement. So we adopt the 4M approach and approach to the like a care service and also healthcare workforce training. Then we like a roll back what was missing, what has to be done more. So we have also the evaluation team of School of Public Health, the Dr. Yeon-Soo Kim and Dr. Jae Shen team. So they are helping kind of the more objective way what we gonna do. Also, they calculate return on investment, how much the education is like impact the care efficiency. That is the helping. So that is what we are doing now.
Yeah, no, makes sense to tie it to a culture and an ethos around that. What about in the childcare space?
Yeah, I think what's interesting, so the early childhood space generally, there's a lot of different systems, and so if we're speaking a bit about childcare, what we want to create it as a viable and rewarding career path instead of it's just a job. It's a job that I go and get paid for. And and we have those people that are in it for that career path. But it's a challenge. It's challenging to recruit people into this rewarding career that's going to be a ton of work, and you're going to be not paid well, and you will not be as well respected as other people working in education. So I worked in early care and education for a really long time before transitioning to academia, and people would say, "What do you do for a living?" And I would say, "Oh, I'm a teacher." And they're like, "Well, what do you teach?" And I said, "I teach toddlers." And they go, "Oh." I was like, no, to me, that's the best age to work with because they're so early and formative. But there is this disrespect, I think, for this sector. And part of that is we don't have a professionalized career for people working in early care and education. And I will say there's national efforts to work through that. So our national association had a big initiative, the Power to Profession, to work on some things. And that does take a lot of things to do, but really seeing this as a viable career path. And so even like in our Department of Education, we really work with our undergrad advising office to highlight that this is a wonderful career path to be in and rewarding, and how can we support people working in that space to get the education they need to be successful in that career without also going into significant debt to get that education. So there's that kind of chicken and egg of like, how do we get people in that career line and be educated and trained to do that, but also not lose money in doing that. And a lot of people are also already working. And I mean, most of our students in the NG system are working in some way anyways, but especially in early childhood, people are already working in childcare centers, and then they come and get an associate's degree or a bachelor's degree. And so we have to work with how to be flexible in our courses and our requirements so that they can keep their job, but also do those things. And also I think the school district is amazing and wonderful. I'm a licensed, Nevada educator as well. But to think about too, we want people to stay in the early care and education space. And also if they want to have options to go into public schooling, that is also great and wonderful. And so thinking about that, and I will say from the nursing perspective, we use nursing as an example of how to take a care profession from this kind of like hourly job into this really structured, trained career path that has promotion and increased skilling ability into that. So we do use that model, but to do that, we really need public investment in lots of different ways to do that. And I will say we've got some great people in Nevada who are really working on this and across institutions and across our state offices to really work on that professionalization of that. The money would be helpful, obviously, but how do we use that money effectively to kind of close some of those gaps?
All right, we're running low and short on time, but I wanted to ask one question. You're getting off the Governor's Workforce Development Board. Great work. Thank you for all your work on that. You led a lot of initiatives in the care space. What are you leaving for your successor? What's the memo that you you leave for your successor?
I didn't have to leave anything. These were pit bulls on bone.
Yeah.
I mean, this is a very, very motivating chronic problem that is not unfixable if we address it, elevate it, give it the stature it deserves, because at the end of the day, if we want the society we want, we can't have these leaky holes in the buckets. Yeah. And early childhood education, and I was told to be irreverent up here, so I will. We're in an institution of higher learning today. Yeah. College is the milestone for every family who wants their children to aspire. But the reality is we have shortchanged early childhood education. And if we started investing a little more time and effort into that part of the equation, we would still have the endless supply of higher ed students, but we would have a lot less of the problem that we have. And it comes down to the people who don't think that they're capable, or they don't want to be in a disrespected kind of occupation. And so the Governor's Workforce Board, I think, doesn't need a memo from me leaving. They are truly motivated to find the business-oriented solutions where there is that economic model that works for employers and works for the employees and serves a greater mission, which creates the productivity and the return on investment that we saw the data says we need.
Yeah, Paul, I'm going to give you the last word here. So your firm works in like 500 markets around the country, all over. Is there any market you see that's excelling in this space?
I think everybody struggles with this everywhere that I work. Some have more assets that they've built on. They're in a better place to begin. And when you're in a little bit better place to begin, you can start making it better. So Minneapolis is a great market. Why is it such a good market? Well, they have had success in a lot of the things that we talk about here, but it wasn't like they have issues that we don't have. They have all the issues we have. I spent 30 years of my life in Pittsburgh, and you might think, well, that sounds like a terrible place, horrible. I'm so sorry that you were there. You wouldn't believe how many people, when I say I spent 30 years in Pittsburgh, who say, I'm sorry. And I always say, oh my God, it's the most beautiful place on earth. And it's just a wonderful, wonderful place. And I think, well, we have all the same problems, but there was a social capital. They talk about social capital, you know what it really is? It's the currency that's created by getting along with others. And if you're in a place that has a lot of old-timers and some newcomers and a lot of comebackers, you have this energy, this currency of you can do anything because you have this social capital. And so with the same problems, some places solve them really, really well. And you were talking about education. I have a doctorate in education, and people say, well, who do you teach? I go, oh, it's terrible. I hate it. but I've been given adults to deal with. But worse, hospital CEOs and physicians and medical school deans. And I'm looking to see if the medical school dean is here. He's not. Good. And what am I teaching? How to make the world a better place. And so the challenges are there. So I want to just close by saying to everybody that it's really the intangible in my teaching and education. And people glaze over when I give that speech. They're like, so he's not a teacher. I don't think so. But I have a real love for seeing communities get better. So anyway.
Yeah, I think your point's well taken, right? Our challenges here is always sort of, flying the airplane while we're trying to build it at the same time and getting those assets in place, knowing that we need more even when these assets come online, and we're always sort of running in place. And hopefully at some point we'll get ahead of the curve there. So please join me in thanking our panelists. Good job.
Good job.
And thank you, of course, for taking time here today. I also want to shout outs to our team, Caitlin and Ashley, for pulling this together, including developing the event poster, our friends at UNLV today, or UNLV TV. I think we're up to about 160 events they've taped. So in a couple of days, once the video is ready, we'll send out a recap of today's event with a link to the recordings there for you to share. On your way out, we have copies of the executive summary from the Tripp Umbach report. We have copies of our report. We have a copy of the child care report. So please take those out there. And just, what you saw today, I think was optimism, right? There's obviously some pessimism in the numbers and where we are here. But I think there's a shared value in the understanding the need to grow and strengthen this care workforce here. We have experts here who can guide that policy. For policymakers in the room, please realize, and Paul's report and my report puts out lots of models and lots of discussions on ways that other people have addressed this problem. So we don't have to reinvent the wheel, but we just have the will to push that wheel forward. So thank you all again.